Let's go.
All right.
All right. Ready to go.
Yeah.
Hello. Hello, everybody. My name is Niusha Mohammadi, and I'm here with our very own Dr. Lance.
Hi.
Okay. So we decided to do a series of podcasts for you guys. And with that being said, the first topic that we picked due to the comments and feedbacks that we got after our first show together was on anxiety. So today we will be covering that real short segments and what's an anxiety and how to deal with it. And I will be asking questions from Dr. Lance, and then he'll be responding to us. Okay, so the first question, in a very general statement, what is anxiety?
Okay. So I was talking to Neosha earlier. This is a hard question to answer quickly, but right, we're going to do our best to do this generally. So anxiety is really, really common, as you were saying, and it happens in all different shapes and forms. For some people, it's really severe. For some people, it's just part of their daily life, and they move through, and it's kind of under the surface. We're going to at some point probably talk about depression as well.
Yes.
And I like to say that those are often paired together.
Okay.
A lot of people, there is some element of anxiety and depression. And I don't think anxiety needs to be this thing where it's like you've got this disease or this diagnosis. I mean, you can have anxiety one day and not another day.
Okay, so it's not a long-term thing.
Not necessarily.
Okay.
Right? And that differentiates whether someone would get treatment with a drug or whether I would use herbal medicine versus just kind of helping someone to process emotionally. On a more physiologic level, right? Anxiety is basically your fight or flight response, right?
Okay.
That's your sympathetic nervous system kicking in a really simplified term. And basically your body is just pumping out a hormone called cortisol, which is your stress hormone.
Yes.
Right. And, so you have this kind of running from the bear response, right? Or you're getting ready to fight something. And anxiety is often that kind of feeling that you have of either feeling like you can't catch your breath. For people that have panic attacks, or this general sense of unease that is driven by that sympathetic nervous system being in overdrive.
Okay, can it be on a certain moment that when we feel anxiety, like how do we feel? How does it feel to have an anxiety? I know how it feels. I'm sure you do.
How does it feel for you?
I mean, I feel like my heart starts pumping faster and I have trouble breathing. And it depends on the situation. But sometimes it's long term. It stays for a few minutes or maybe a few hours, and sometimes it doesn't.
Yeah.
Is that right?
I have the same experience,
Okay.
I've had issues with anxiety for a greater part of my life.
Okay.
So I understand it well as kind of a part of myself. I think that's what makes us good healers, is when we have a direct experience with these things and we can sympathize. I kind of feel it the same way, you know. Some people, I think it's subtler, for other people it manifests as panic attacks or feeling like they can't breathe. That fast heartbeat in your chest, that's the sympathetic nervous system I was talking about. When your fight or flight response starts to, speed up.
Okay.
Some people, it feels like depression. Some people, they get anxious, and because they're anxious, they get depressed, or vice versa. So.
Okay. So, I mean, if it lasts for a longer time, right? That can be depression, right? Is that right?
It can be both.
It can be both.
I think anxiety disorder, depressive disorder, those are more, when we look at diagnosis, long-term things. But you and I can have anxiety and still not have, a disorder that needs to be treated. Okay.
So that brings us to our next question, which is, how do we deal with anxiety on long term and short term?
Yeah.
You want to start with long term? Or short term is easier?
Let's start with long term.
Okay.
For some reason that feels right.
Okay.
I think the most important long term thing is to change habits. balance.
Okay.
You know, it's kind of like, I mean, changing, and granted, I think for everyone it's different, you know, because some people need more support than others.
Mhm.
Some people that are severely anxious, you know, while I'm not a physician, so I don't prescribe drugs. There are some situations where people need a drug, you know, and I try not to recommend it, but there's a time and a place. Sometimes it's as simple as using an herbal formula or supplement.
Okay.
And sometimes it comes down to just making lifestyle changes and help people to reframe their experience.
Okay.
And oftentimes long-term treatment of anxiety involves at least one, if not more of those things.
Okay. So that's for long term.
Mm-hmm.
And then, like, give us an example for lifestyle changes that you
Yeah.
talked about.
So I think one of the biggest things that I focus on, you know, we talked about the sympathetic nervous system.
Mm-hmm.
You know, we talked about anxiety being this kind of amping up of your body. And there are kind of two ways you can approach it. I know talk therapy is one thing that people talk about, but I think it's not the only way, you know? And so
Okay.
for me, I kind of look at, okay, well, how do we approach it from the other side?
Mm-hmm.
So what are practices that you can learn how to do to slow down your nervous system? I think
Breathing.
breathing
Best word.
exercises is probably one of my favorite things.
Okay.
Meditation,
Mm-hmm.
doing, you know, and for everyone, it's a little bit different. You know, some people, they do breathing practices and it makes them feel more anxious, you know?
It does. In the
Yeah.
beginning, it does, I feel like.
Yeah. Well, and for some people, always.
Okay.
You know, and so then it's a matter of saying, okay, well, what do we need to do that's different? You know,
Okay.
for some people, the way they need to do it is meditation.
Okay.
Some people need hypnosis. You know, I think that's more of a kind of like when I'm sitting in front of someone and
Mhm.
getting a sense of what's going on,
Mhm.
then I kind of target it more specifically. But I think in general, breathing is a really, really, really good place to start for most people.
Okay. Will you be able to tell us one breathing method?
Totally. I'm so glad you asked. Right. So the breathing method that I most frequently use is what's called paced breathing.
Okay.
Right. So what I think is good to know about the nervous system, right? We talk about this fight or flight response, and
Mhm.
then we talk about I was checking our
We're good.
time.
Yeah, we have 2 minutes.
And we talk about the parasympathetic nervous system, which is that rest and digest,
Mhm.
right? So you have these two parts of the nervous system. And I think that what people misunderstand is they think, well, we want to be parasympathetic. We always want to be in this resting part. But that's not true. Actually, what really relaxed looks like is that you cycle back and forth between those two things.
Okay.
And that's what we call nervous system balance. And what paced breathing does is it actually does that, right? It actually kind of restores that balance between the sympathetic and parasympathetic, and it relaxes people in the moment, you know?
Okay.
So a good example of paced breathing is kind of the standard pace I do for most people is 6 breaths per minute, or about 5 seconds per inhale and exhale.
Okay.
And we do it slowly. I wish I had a metronome on me or something so that I could. I actually, if you want, I can play a little bit,
Sure.
a breathing track
Let's do it.
that I use for my patients, so you guys can breathe with us.
Let's breathe.
Isn't it exciting?
How long is it?
We're gonna probably take a little break.
Yeah, we're gonna take a
and
break.
then we'll come back and we'll have a good time.
Okay,
All right.
good.
Awesome.
Alrighty. Well, we have a minute. So
we do have a minute?
yeah, we do have a minute.
Okay, well that gives me time to kind of look for
Look
this
for
track
it.
and
Okay.
we'll keep talking.
Yeah, so anxiety is something that I feel like all of us have experienced at some point, and just knowing, yeah, right here, knowing how to deal with it at the moment or in a long term is very important. And there are methods that, I mean, if it's long term, we talked about like you can use medication or. I personally rather to train my body and my mind not to do it, but
And we'll also talk about some herbal things that I will
perfect.
often recommend to
Yes,
people,
yes.
Which I think are generally safe for most people.
Okay.
I'm not a huge fan of saying we're good
We're
saying this is a supplement you should use, but
Mhm.
just having some general information can be useful.
Perfect. All
So,
right. That wraps
more to come in
more to
in a few.
come. Yes, that wraps the first segment. We'll be right back. Ready. All right.
Hi, we're back again. So we left off with maybe doing a little breathing exercise.
Yes, let's go over that.
If you're driving home in your car or something, be careful, don't fall asleep. So I'm going to play a little musical track that I put on for a lot of my patients, and I actually send them home with it so they can practice on their own. One thing I'll tell you before we do it is practicing breathing is like going to a self-defense class.
Okay.
So if you go to 1 week of self-defense, Niusha, and then I mug you on the street because I'm a bad person, right? I would never mug you on the street.
You'll never
right?
do
Yes,
that.
and somebody mugged you on the street.
Uh-huh.
Do you think you'd be able to remember your self-defense after 1 week?
No.
You would forget it.
Yeah.
It would be all gone.
Yeah,
right?
of course. Yeah.
So with breathing, that's what I tell people. Don't expect like immediate changes. You have to practice it every day so that you have to practice it when you're not stressed too.
Okay.
So that when you get into moments when you're anxious, you actually have a good foundation so that it becomes more effective.
Okay.
But even still, it's useful. So are you ready?
Let's go.
So with this kind of breathing, you're breathing through your nose. The mouth is closed, right? And you're trying not to make any sound.
Okay.
So you try to make it really quiet. As the music sound goes up, you inhale. And as the music sound goes down, you exhale. We'll just do this for a minute, okay?
Okay.
All right, so you guys ready, everybody? So turn on this music. Inhaling and exhaling. Oh, shut off, but that's okay.
That was really good.
So how did that feel?
It felt really good.
Did you notice a change?
I did.
What did you feel?
I felt my heart.
Okay.
Yeah.
What did you feel? What did you notice?
I noticed that my breathing was slower, and I couldn't think about anything
because you were focusing on the breathing.
Yeah, on breathing.
Right?
Yeah.
And did you feel like you kind of just like everything kind of
slowed down? Yes.
It's really fast. It works really fast. And when people come into my office and they say, I've tried breathing, it doesn't work for me, usually it's because they haven't been breathing right.
Okay.
You know?
So how do we find this music?
You can't.
Yeah, I can't. Oh,
you can't. I know this is. I've actually tried to look for it online, and I cannot find it. So you'd have to get it from me. I can text it to you specifically. There are other apps out there, right? So there are a few apps on what is it? On
App Store.
Yeah, on the App Store.
App Store.
Thank you. I need to be breathing more today.
You're fixing to go teach your class.
I know. There are a lot of apps out there. And for most of them, 6 breaths per minute is kind of standard.
Okay.
What I like about this track is it kind of, you hear the music all the way through. And so that you can kind of gauge, you know, when you need to inhale and exhale.
Okay.
With a lot of them, you get like a little ding at the top and a ding at the bottom.
At the bottom, okay.
Which works.
Okay.
It still works. It's just kind of like, I find when I do it, I'm kind of like left guessing, thinking, okay, is the ding coming? Is it time? Is it?
Exactly, because you're still thinking about.
Right. And so I think it's a little bit harder to sink into it, but it's still, it's still really useful.
Okay.
So App Store.
And then when would be the best time to practice this?
Anytime
during the day.
If you have trouble sleeping at night and you feel anxious, I mean, there are a lot of other things with sleep. Maybe that'll be another podcast.
Yes, for sure. Yeah.
But before bed,
Okay,
you
before
know,
bed.
and
Or
I
when you first wake up in the
or
morning,
when you
like,
wake up in the morning, I tell people to do it for 5 minutes.
okay.
I'm just looking at 2 apps I have on here. One of them is called the Breathing Zone. I actually like that one.
Okay.
And then there's another one called Headspace.
I love
Do you know
Headspace.
Headspace? Okay, great.
Yes, yes.
Yeah.
I've been using it for a
And
long time.
and you just have to make sure that whatever the breathing rate is, you set it
Mhm.
to that 6 breaths per minute or 5 seconds of
Okay.
inhale and exhale.
Okay.
And that's, like I said, pretty standard for
Mhm.
most people. When I do biofeedback for people and I kind of hook them up to a computer and
Mhm.
watch them more specifically, sometimes I will kind of refine their breathing, and some people need to breathe a little faster or a little slower to benefit their system the best. But for most people, like that bell curve, most people are kind of in that 6 breaths per minute place.
Okay, I see.
So that's helpful for most.
Okay, so breathing, very important. And breathing helps with everything. A lot of other things, not just anxiety.
You need it to survive.
Exactly. You can't stop breathing.
Yeah, I was like, I'd like to see you not breathe for 10 minutes and then come back.
Ain't gonna happen, no. Okay, so what are some natural ways of dealing with anxiety?
Sure. Well, one that I'm sure everyone has probably heard of is lavender.
Okay.
Lavender is a big one. You can use lavender essential oil for sure. You can just get the lavender itself. If you have a lavender plant at home, you
I've
just
been wanting
cut off
to
a
get
couple
one.
sprigs. They grow like weeds. They're super easy to grow.
Really?
And you can just
Smell
lavender.
Okay.
There are a few herbal products that are there are a few herbal products that are lavender based, but that you have to get them through a practitioner.
Okay.
You might, if you go to Whole Foods or the health store, you might find lavender capsules with lavender oil in them.
Okay.
If you do, you usually take them I usually have people take them in the evening if you can find them.
Okay.
The product I like is called Lavella, and it's by Integrative Therapeutics, but I don't know if you'd be able to find that on Amazon. You might.
Okay.
Whole
Foods, I'm pretty sure.
Whole Foods wouldn't carry it because it's for providers only.
Oh, okay.
So a provider has to order it, so I'll order them. But you might be able to get it on Amazon.
Okay.
Try.
Okay.
Watch out for lavender burps.
Okay.
So people will take it and then they'll burp up lavender smell. It's not so pleasant, actually. It's not as pleasant.
Really?
It's really not.
Okay. Okay.
So there's that. I think one of the other major things that I will often recommend to people are what are called adaptogens. And these are kind of a series of herbs, right? There's a lot of them. One that I think people have probably heard of is astragalus.
Okay.
Right? Astragalus root. Another one is one called ginseng. Ginseng is actually an example of an adaptogen. And another one called ashwagandha.
These are hard. Okay,
they're hard to pronounce. So don't worry about the specific names, right? Okay. I'll say them one more time. Ashwagandha. Right? Ginseng, everybody knows that one.
Ginseng, yes.
And astragalus. Yeah.
Okay.
And if you go to the store, you might even be able to find individual herbs.
Okay.
But what you'll find if you go to the Whole Foods or health store aisle is you might actually find adaptogenic formulas. Okay. So you can look for capsules, in bottles, ask the person for adaptogens. Okay. Right? And they'll usually direct you towards a supplement that'll probably say something like stress or anxiety.
Okay.
I can't guarantee that what you'll find at the health food store will be the best. I have a few products that are really well researched that I tend to use. Once again, we're right at the bend.
Yeah.
Phytozone by Thorne Therapeutics. You can check it out on Amazon, see if you can find it.
Okay.
So those are two great places to start: lavender and adaptogens.
Okay.
Generally, both before bedtime,
natural
and in the
remedies.
Morning.
Okay.
Natural. I use them for a lot of people. So
all right, 20 minutes is a short time.
Yeah, 20 minutes. We cut it right towards the end.
Right, perfect. Okay, so
if you have questions, ask us questions. We can follow up. So
yes, for sure. Thank you so much.
Thank you for having me. Yes. Oh, yeah. I'm Dr. Lance or Lance. You can find me on Instagram at drlance.houstonintegrative,
Thank you.
So yeah.
Until
awesome.
next time, you guys.
Fantastic.